The thoracic cage supports the thoracic cavity and it protects the internal viscera. It's composed of the vertebrae, the ribs, and sternum, and it is the attachment point for muscles that are involved in breathing, the position and posture of the vertebral column, as well as movement of the pectoral girdle and upper limbs. Do you think men and women have the same number of ribs? They do. We have 12 pairs of ribs. The first 7 pair are called true ribs because they're connected directly to the sternum by cartilage. The next 8 to 10 are called false ribs, and they are connected to the sternum by cartilage as well, but the cartilage goes to the cartilage of the true ribs instead of the sternum. And then the last two pairs are the floating ribs, and they do not connect to the sternum at all. You need to know the parts of the sternum. The upper rounded portion is the manubrium. You can feel that if you put your finger in between your clavicles up by your throat, that you're touching the top of the manubrium. The body is the main part, and the xiphoid process is the pointed inferior portion that may break when CPR is performed. Which of the following attach to the manubrium? Just the first rib pair, and let's go back up there and look at that again. So here you can see the manubrium and that first pair of ribs. That's really quite high in your chest, higher than most people think. We'll talk about some types of curvatures. Kyphosis is may have been called in the past hunchback, and that is caused by compression fractures in older people and osteoporosis. People may be born with this condition. It may be caused by abnormal growth of the vertebrae. Scoliosis is lateral curvature. You can see that. And lordosis is maybe called swayback, and that may be a condition of pregnancy. The pectoral girdle connects the upper limbs to the trunk. It consists of the 2 clavicles, they are S-shaped, and the scapulae. Which of the following attach to the manubrium? Do you remember this one? The first rib pair. So there's the clavicles, and there are the scapulae. In 168, you need to learn a variety of terms like the acromion process, the coracoid process, the glenoid cavity. But in this class, we just basically learned the bones. Which of the following is part of the pectoral girdle? That's the clavicle. Do you recognize this bone? Your upper arm is the humerus. Look at all those different terms that we do not need to know. This is the radius and ulna. The ulna, it's a little bit difficult to see from this picture here, but there's a U-shaped notch here called the trochlear notch. The outside of that is your elbow, and you can think of U for ulna, and the radius has this flattened little head. You do not need to know the individual bones of any part of the wrist or hand. Here are the carpal bones. The metacarpal bones are your hand bones, and then the phalanges are your finger bones. Here is the coxal bone. It's connected in front by what's called the pubic symphysis with fibrocartilage, and it articulates with the sacrum in the back. This part of it is called the ilium. These are basically 3 bones fused together for each half of the coxal bone. The pubis and the ischium. When you put your hands on your hips, you're putting them on the crest of this ilium. This is the socket is where the femur fits in. There are differences between the male and female pelvis. And a couple things, the coccyx, which is the tailbone, in a female curves outward more. There's more of an inward curve in the male. The male has got more narrow. See how flared out the ilium here is in the female compared to the male? And then if you look at this angle down here, the angle differs. The angle is smaller in males. All this relates to the fact that female must bear children. Here is the femur, different from the humerus in that there's a neck here. And then distal to the femur is the tibia, and your kneecap would be right up here. All of our weight goes onto our tibia, and this thinner, so think of tibia tuba, it's the big one, and the fibia is the flute, it's the thin one. Tibia is the tuba, fibula is the flute, and down here would be your inner ankle and your outer ankle. This fibula is lateral. You don't need to know any of the foot bones except for the calcaneus, which is a large bone that is your heel bone. You may see references to the talus. This is where our weight comes down from our body, from the tibia onto this talus here. This is showing the different arches of the foot. Which of the following is not a long bone? The calcaneus, our heel bone. And then finally in this chapter is joints and joint movements. A joint is called an articulation, and movement occurs there because 2 bones are connected there, allowing some movement. We can categorize these joints by function. That is, some of them have no movement, some have a little bit of movement, and some have lots of movement. So if you think of the word sin means together. So the bones are basically fused together and there's no movement. Synarthrosis is no movement. The joints that we think of typically on the body, where we're moving, our elbows and our knees and our hands, those have free movement. Those are diarthroses. And amphi means both, so it's a combination of no movement and free movement. It's a little bit of movement. You do not need to know any of these categories here, but we can categorize, just as I did, the joints by function or range of motion, and we can categorize them by structure. That is, what type of material binds those bones together. Sometimes it's cartilaginous, sometimes it's fibrous, sometimes it's bony, sometimes it is synovial membrane. So the rest of the chapter talks about synovial joints. Those are freely movable diarthroses. They have the bones coming into the joint have articular cartilage. A synovial joint has a joint capsule, and it is lined with a synovial membrane, which creates synovial fluid. Synovial fluid's a little thick, a little bit like egg white, and it cushions and lubricates and supports the chondrocytes. A chondrocyte is a cartilage-producing cell. So here's a typical synovial joint. The two bones coming in are covered with articular cartilage. There is a joint capsule that is lined with a synovial membrane that makes synovial fluid that will be in here. The synovial fluid lubricates, allows for nutrient distribution. There is no blood flow to the connective tissue, and shock absorption. The only joint you need to know well is the knee joint, because that is the most problematic joint on the body. So our knees have these accessory structures. We'll show pictures of these in a second. A bursa is a fluid-filled sac to reduce friction and absorb shock. Fat pads protect and fill spaces. And a meniscus, it does absorb some shock and it allows for some variation in shape. So here's our knee joint. There's some fat pads. A bursa, there's a bursa right anterior to your patella, your kneecap. So if you land on your knee, you're actually landing on the shock-absorbing bursa, so it doesn't crack your kneecap. You may have heard of bursitis. That would be inflammation of the bursa. It often happens in the shoulder joint. Here's some more bursa here to prevent rubbing and friction. And then there is a pad of fibrocartilage here called the meniscus, and that these bones coming into this joint are not perfectly shaped, and it allows for variations in shape. There are 6 different types of synovial joints: gliding, hinge, pivot, condylar, saddle, and ball and socket. And we will only learn a few. We don't need to learn all of these joints. The one that's easiest for students is the ball and socket. That allows movement in many directions. That would be our hip bone and our shoulder joint. Pivot allows rotation. Our head can pivot as the atlas rotates on the axis. A hinge joint is our elbow and our knee. It permits movement in only one plane. Which of the following is a cartilaginous joint? These, we didn't have to learn these. But the pubic symphysis is fibrocartilage, and that connects the two hip bones in the anterior region. What type of joint is found in the hip? Know this one. That would be ball and socket. What type of joint is found in the neck? Know this one. A pivot joint. And what type of joint is found in the elbow? A hinge joint. Which of the following joint types is affected by a damaged meniscus? So the meniscus was in our knee, and our knee is a synovial joint. The discs that are found between the vertebrae are called intervertebral discs. They're made of fibrocartilage. Unfortunately, the core is gelatinous, and when there's stress on a disc, it can squeeze out. So here the inner core is squeezing out a little bit, and that is called a herniated disc or a bulging disc, and can push on spinal nerves and cause some pain. There you can see that compressed nerve. Osteoporosis is normal with aging. Women get it more than men. And it is just a condition where the bone becomes much more porous. So both of these pictures are of spongy bone, but you can see the difference between normal bone and spongy bone with osteoporosis. And it is recommended that women have a good calcium intake 5 years before they expect to go through menopause, because the calcium is lost after menopause. Here's a compressed fracture. And arthritis is important in the joint chapter. Most people are affected by